Hi, I'm Brandon Leonard, Director of Strategic Initiatives with Men's Health Network. I'm here today speaking with Darrell Sabbs, Prevention Outreach Manager with Phoebe Putney Memorial Health System in Georgia. Darrell, thanks for taking the time to speak with me.
Great job, Brandon. That's a mouthful. Yeah,
Thank you. I appreciate that.
Right.
I worked on that.
Yeah.
So tell me a little bit about the work that you do down in Georgia, particularly related to outreach to men.
Well, I am so happy when I get to come up into an area like Washington, D.C. and talk about some of the work that we're doing in Southwest Georgia. Very rural, very poor, one of the poorest congressional districts in the country. The affordable care has not really been affordable in that area as of yet. The chronic disease is like off the chart. The diabetes, the death rate, the level of sickness, and the health status in general, and particularly when it relates to men. And so it gives me fertile ground to be able to come in and build some trust, build some hope, with the assistance of a hospital or a health system that gives me opportunity to go upstream and really help men particularly realize how important it is for them to think about their blood pressure, their cholesterol, the fact that they're smoking, the fact that they're not active. In fact, all of the major research is now telling us, I don't care if it's the American Heart, if it's the Diabetes Association, if it's American Lung, they're all saying the same things now. If you practice early detection, if you eat better, if you're active, and if you don't smoke, then a great deal of the disease and death that we experience could be prevented. So I work in an area where there are not many providers. There's not much of that message being delivered. Not many stories of successes being told. And so when my voice or the voice of the hospital comes along saying, you can do it, it's possible to prevent a lot of the destruction that's happening to families and to men. And when we say it, this is important now, when we say it in a loving, caring, compassionate way, then men will respond to it. All this talk about men not getting involved and men not knowing that they should get involved, yes, some of that is true. But I've learned through working with men that it's how you tell us, how you recruit us in, and how we bridge the gap of faith and trust in what we're being asked to do, There's not that much of an enigma when it comes to where are the men and why not the men, It's sort of like if you build it, they will come. But you got to see yourself in it as a man. You got to see yourself in the recruitment, in the program service. It's almost like if we were to take a picture of ourselves and have it given to us. The first thing you're going to do is look for yourself in the picture. I mean, something about our nature, you try to find yourself in things. So if men can't find their self in the recruitment, if they can't find themselves in the service, they tend to shy away from it. We already got this macho male mentality going on where we shouldn't cry or we shouldn't hurt or we shouldn't complain or we shouldn't. But actually, we are very fearful, and I get guys sometimes who are 6'3", 240 pounds, and they're scared of a needle. You know what I mean? Men will respond. Men can respond, and they will do it in successful numbers if we know exactly how to craft and how to build the message and the service to get them to come. And when they do, in health, you see the results. I get people who come to me now, I get daughters and sons and wives who say, you know what, if it were not for that health fair, my daddy would have never found out that he had prostate cancer. And so it saved his life, and I want to thank you so much for that. So you get those kind of testimonies, and I live in an area where people have little of nothing. So when you put something in there, it's like a doctor's visit for them. I've been doing it for 15 years. It's their annual doctor's visit. The fellowship is absolutely wonderful. The doctors come, and these wonderful, beautiful nurses are there, and they get treated and pampered. So it's almost a pampering day for men. But in the course of that, they learn a lot about their responsibility. Men have, we have mechanics, we have lawyers, we have barbers, but we don't have doctors. You know what I'm saying? It's just not in our appreciation of life. But once we get introduced to it, and we see that it's not going to hurt us, you know. In fact, it will, in fact, help us. We do it. I think we do it well.
So, we know that in a lot of the main health indicators, men are really lagging behind and have been for a while. But I don't think that men's health is necessarily the first thing that people think about when they think about a health crisis or a health issue we need to address. Was there a turning point for you when you realized, or an aha moment where you said, like, wow, this is something, like, we really need to do something to take care of the men?
Let me tell you what we think about first, our sex health, our sex interest, really. I think Viagra, Cialis, has done more to drive us to the doctor. Our interest in our, you know, that's us. You know, we're interested in that particular area. And a lot of times when we get there, or in order to get the script, you got to get a checkup, and the doctor will find out a certain thing. It's interesting what has driven us there. But once the fear is gone, and the doubt about what will happen to us is erased through a good experience. And there's some wonderful doctors out there, some doctors who do understand men and the mentality of men, and they're doing quite a bit. But I don't think it's really hard. I don't know if that answers your question. What was you?
So, you've been a part of this Dialogue on Men's Health series since the beginning, really, and I know that you've come to present on the excellent programs that you've been doing down in Georgia. Can you talk a little bit about what you would hope, what you've seen from that dialogue process, and what you would hope would come from it?
Well, for me, working in a rural area, coming into this environment and listening at the experts who study it and who spend a great deal of time on the analytical aspect, on the research, on sharing the data and the findings from the research. For a guy like me, that is so important because it makes my work so much easier, because I don't waste a lot of time on strategies or activities or discussions that are sort of fruitless. You know, I can look at the data and I can look at the analysis, and I can look at some of the best practice models that the academic or the research community has already taken a look at, and it helps me make decisions on exactly what services or exactly what approach or exactly what the men's belief and thought process is, because a lot of that is discovered through not just one-on-one talks with men, because there are a lot of general characteristics about men that if that subject is studied and surveyed and given some kind of analytical watch, it helps a guy like me who's on the ground doing work. First of all, sound very smart, because I can talk about based on this and due to the fact of that, and the analysis of a report that came out such and such. It just adds credibility so much to the work that I do in neighborhoods and in communities all throughout the South, and that credibility matched with the service and the resources is what helps to bring success to what I do, you know.
If you had one simple message for men regarding their health, what would it be?
Well, it would be to not neglect your health. I mean, men, as I'm sure some of the other ones have said, men die quicker and sooner than any human on the planet, you know. And men are very valuable to the families and to production in our culture and in our society. And for men to be missing in their families, missing in workplaces, and missing in all of those productive places that bring success to our society is a travesty. I'm the oldest living male in my tribe, and I'm 63 years old. I don't have a grandfather, I don't have uncles older than me, and that's probably not very rare. You know, we die sooner and quicker, and so if you just take notice of how valuable you are and how much you're needed and how much you're wanted and how much you're loved and how much you can contribute to the success of your family and your community by just making a few simple choices in your life. You know, put them cigarettes down. You know, get out and be active. It's fun getting up in the morning and taking a nice walk, you know what I mean? Or consciously doing something actively, you know? Go to the doctor. Don't be afraid of that doctor, you know? And get some good screens. Get rid of that fried chicken and that fried fish, man. You can bake it, you can broil it, you can do so many other things to make it taste good, and it will, you know, give you some longevity in life and longevity in love.
Okay. And Darrell, thank you so much for taking the time to
so
talk
much,
with
Brandon.
me today.
I appreciate you.
Appreciate it.
Yes, sir.